Hello, Dr. Utku. Can you tell us a little bit more about yourself today?
For sure. My name is Dr. Utku Tantoglu. I'm a general surgeon. I mainly deal with obesity and metabolic surgery. Most of the time, I'm performing gastric sleeve surgeries, type 2 diabetes surgeries, metabolic surgeries like gastric bypass surgeries, and as well, I'm performing gastric balloon treatments and gastric Botox injections.
So, Dr. Utku, can you tell us a little bit more about the process and procedure that relates to bariatric surgery patients?
Yeah, for sure. It can be a little bit frightening, but no worries. It's pretty simple. You're going to come to the airport. We're going to take you from there to the hospital, and we're going to check you precisely. And if everything is okay for the surgery, we're going to take you to the surgery one night after. And you're going to stay for this night, and the day after, we're going to perform a leak test. And you're going to stay one more night, and we're going to take you to the hotel for your rest for one more night. And after these happen, we're going to send you to the airport, and you're going to go to your home. It's pretty simple, no worries.
Can you tell us a little bit more about post-op period that relates to bariatric surgery?
Yeah, for sure. It's a frightening issue, but most of the time it's pretty tolerable period. It's okay for you to get frightened about the surgery, but most of the time, only first night after the surgery can be a little bit uncomfortable for you. I mean, you can feel nauseous, you can throw up several times or so. You can feel a little bit pain in your holes, in your belly. But after this night, you're going to feel pretty good. And in first 10 days, you can feel a little bit fatigue, and it's all depending on your fluid intake. If you take enough fluid after the surgery, you're going to feel pretty fine.
So, Dr. Utku, can you tell us about the weight loss period? How much weight loss they see over the coming months after bariatric surgery?
This is a pretty common question. It depends on our initial weight. It depends on the initial weight of the patient. In general, I can tell you that you're going to lose like 10% of your initial weight after 1 month. And after that, weight loss goes on to 6 months, and in the 6 months you're gonna lose 80% of your excessive weight, and then weight loss goes on to like 1.5 years, but it goes slowly, and after 1 year and 1.5 years your eating habits will be pretty good and you're gonna feel pretty fine.
So, Dr. Utku, can you tell us what are the criteria where you differentiate if this patient needs a gastric sleeve or a bypass or a gastric balloon or Botox?
Yes. Mainly it depends on the body mass index of the patients. We need to calculate the patient's body mass index. And if it is about 30, we can talk about surgical procedures like gastric sleeve or gastric bypass. But I need to differentiate it by talking to the patient. It's a little bit complicated, but mainly we're going to choose the patient. We're going to choose the procedure to patient depending on the body mass index. If your body mass index is lower than 30, we need to talk about gastric balloon or gastric Botox injections.
What is the major difference between gastric sleeve surgery, bypass surgery, and then not having operative treatment, but a non-invasive treatment like Botox or balloon?
Yes. The main difference is gastric balloon and gastric Botox injections are not surgical procedures, but we need to choose the patient by the body mass index of the patient. And the main difference about these procedures, surgical procedures and non-surgical procedures are, non-surgical procedures are temporary. It affects like 6 months or so. By this way, if we need a permanent effect on the patient, we need to pick surgical stuff.